Hi, I'm Dr. Jake Coffman, and this is episode 7 of What's the Research Say? Today we're going to be diving into the research behind an adjustment and the effects it has on the body based on the research. Before we start out, I want to point out that this is only one aspect of the science behind an adjustment that we're going to be going over today. There are multiple different ways an adjustment can affect the body as far as cerebral spinal fluid, hydrodynamics, the denticular ligament tension, dural tension, and much more. Today we're going to be focusing on the sensory motor aspect of an adjustment, and to help this come full circle, let's start talking about what normal is. In a normal functioning spine and nervous system, you have input coming into the brain telling the body where it is in reference to itself. It travels along what is called afferent pathways, and the information is picked up by sensors throughout the muscles, joints, ligaments, and even bones. These sensors send information, what we call afferent information, from every point in your body to your brain. But before they get to the brain, they meet up with information from your eyes, your visual system, your inner ear, the vestibular system, which has to do with balance. And all this information is then integrated when it meets in the cerebellum. This information then gets sent to the thalamus, the sensory motor cortex, so the body can change and adapt appropriately to this input. This is called sensory motor integration. This is all happening in less than milliseconds and is what keeps you upright and your body balanced and functioning correctly when in proper alignment. When someone is healthy and in proper alignment, they have the proper afferent information being sent to the brain. However, when there is pain or structural damage or misalignment of the structures, aberrant or abnormal afferent information is sent to the brain, and when it gets to the cerebellum isn't able to integrate this information properly. Think of it like someone giving you instructions to do something in French when you only know how to speak English. You wouldn't be able to perform the task. This is similar to what happens when the body receives aberrant afferent info and it's sent to the brain. The body isn't able to fully complete the task that it was given. Add on to that when there is pain in the neck or an injury to the neck, that it can cause the cerebellum to not be able to fully integrate the information that it's receiving, and you have a negative impact on the brain and the entire body. Specifically speaking, you have a decrease in cortical function and further structural breakdown of the body. This aberrant afferent information could be the reason why individuals with multiple concussions and whiplash are known to have an increase in injuries and pain after their concussions. They've also looked at balance in a population that has sustained whiplash and found that balance was decreased after a whiplash injury, and that this could result from an issue in the vestibular-cervical interaction where that information is integrated, which, as you remember, that happens in the cerebellum. So what happens when a correction or an adjustment takes place? A lot. Well, remember when at the beginning, when we talked about these sensors that send information to the brain? What an adjustment does is it helps these sensors start firing correctly through stimulating multiple types of receptors in the spine, in the muscles, in the ligament, in the tissues. This starts to normalize that afferent info that is going to the brain and eventually results in a return to normal alignment, or as close to, based on how much the body has broken down. This results in an improvement of sensory motor integration and a stabilization of the cerebellum to integrate this information properly. Oftentimes, because of this proper input, you then get a decrease in pain and a return of normal function. So when the body is out of alignment, sensors and receptors send improper information to the brain, which can result in problems throughout the body because the brain then sends the wrong information back to the body. By correcting the alignment, the sensors and receptors start to fire correctly to the brain, and the brain is able to then send the right information back to the body. We're done with the main part, but if you want to stick around for a deeper look into the neurology, don't go anywhere. Let's start with some more background. Multiple studies have looked at after trauma to the neck, like whiplash injuries, and how there's an increase in central hypersensitivity in chronic pain. They've looked at the increased incidence of fibromyalgia after sustaining a cervical injury, and they found that after suffering cervical spine trauma, individuals were 13 times more likely to develop fibromyalgia. A recent study published in the Journal of Sports Medicine concluded that concussion may increase the risk of lower extremity musculoskeletal injuries, like ACL tears, rolled ankles, and more. They concluded that the increased risk of injury might be due to a direct impact on neuromuscular control due to reduced excitability of the motor cortex. So why does all this matter? Well, it goes to further show when there is injury to the neck or head, this leads to aberrant information, a decrease in cerebellar inhibition, and then a decrease in cortical function. This often results in a decrease in reaction time, a decrease in sensory motor output, which results in an increased risk of injury and a decrease in recovery. Through structural correction, what happens is you normalize that afferent info by stimulating the mechanoreceptors in the spine. This results in an increase in cerebellar inhibition, an increase in cortical output, and an increase in reaction time, and an increase in sensory motor output. One could even conclude that it could also lead to a decrease in the risk of injury and an increase in recovery time. So how do we know that's what happens with a structural correction? Because the research shows it. The first study looked at cortical excitability and showed lasting changes in cortical excitability, which is often reduced after concussion or neck injury. The second study showed that correcting the structure alters sensory motor integration, and that area that is primarily stimulated during a correction is the prefrontal cortex, which may be negatively affected during a concussion or after a concussion. The last study showed that structural correction can increase cortical drive and positively impact sensory motor integration, which is often seen to be decreased after concussion injuries, and may be the reason athletes are more prone to lower extremity injuries after a concussion. I hope you found this information helpful, and thanks for watching episode 7 of What's the Research Say? I hope you enjoyed it, and as always, if you have any questions, please email me at drcoffman@optimizecolumbus.com. Thank you, and have a great day.